Good evening and welcome to the Thai PBS World. The number of new contraction of COVID-19 in Thailand has risen sharply, especially today, to 60, make the total number of infection in Thailand is 272. In the meantime, the government has announced to step up the preparation measure in order to cope with the next phase, just in case that the country has to go into phase 3 of the outbreak. And in Thai PBS World tonight, I asked Dr. Thanarak Phalitpat, the Deputy Chief of the Department of Disease Control, whether Thailand is approaching national lockdown. It's not national lockdown yet at this point. And the government said they encourage or have order to close down stadium, boxing stadium, restaurant, all the public activity, and told us to have less and less mobility. Is it at the right time to have this measure at this time? At the right
Of course,
point?
yes. To me, yes, I think it's a very good measure, and it's about time that we do it. One thing we may question is there anything else we could do? But I'm happy with what we have, what we got, at least for now. But all of this is the government measures. We ask for collaboration in so many different fronts. For example, one of the measures that we ask is that can the workers within Bangkok, any occupation, private or public, could we start our work at different hours? So at the moment, most of our work hour, office hour, start from 8:30 or 9 o'clock until about 4:30 to 5 p.m. Could we start from 6 and end the day at about 2 or 3 p.m.? Or some may start from our office hour from 12 p.m. until about 8 p.m.
Do you mean government sector or every public and private sector?
Public and private.
To try to make different time slots of working hours.
Yes.
And how does this will help?
It will spread the people. Instead of having just rush hour of just about 1 or 2 hours, everybody is going to public transportation, go to SkyTrain or to underground train. You see that during the rush hour, our public transportation is so crowded.
And that's the risk.
That's the
risk situation.
Right. So it is not just the government measures that will help our countries. It is everybody collaboration that will help the countries. Now we have to start to think of what we can do to help the situation.
Yes.
Not just what the government would do.
So it means that private sector can announce independently to try to have different shifts of their employees.
Yes, or even work from home.
Yes.
Yes. For example, if we could reduce the workforce who have to go out every day to work down by 10, 20, 30% or even 50, 60%, that would be great, not just for the private, but also for the public sectors.
Yes.
In the government sector, there are so many things that we can work from home. If we can do that, we will reduce the number of people going out from home. So that is what we call social distancing. That would be good for the situation at the moment.
Yes.
So
it's like how we sit at the moment. We try to keep distance as well. Is this enough for social distancing in normal situations?
Generally, just about 1 or 2 meters, that would be okay. Right. So the government is trying to what I would say to build the environment that we can live within this environment safely. But everybody else have to do their part as well, not just what the government can do.
Yes. People must be wondering, and this is like the ringing issue all over the country, I guess, especially when Prime Minister Prayut Chan-o-cha today that we need to step up measure and try to get ourselves prepared for phase 3 of COVID-19 outbreak. So what's the phase 3 and are we approaching it?
I think we are at the point that we are reaching that phase 3. Phase 3, we define it as having local transmission sustained sustain local transmission. That is, the transmission of COVID-19 is spread within our local community and spread more widely, and more people get infected. The main reason that we divided the epidemics or the outbreak into different phases because of the management of the situation as well. If we approach phase 3, we will announce that not every cases need to come to the hospital. If you have only mild symptoms, you can stay home, take antipyrexic drugs, paracetamol if you need it, you drink a lot of waters, and then trying to prevent yourself from spreading the disease to your family members.
So at the current stage that we are into in Bangkok, in other provinces, you emphasize again that it's different situation. But as of now, it seems the cluster of the infected case are in Bangkok. So what do you like to tell people in Bangkok? What should we do and how to protect ourselves?
At the moment, the measures or the interventions that we do change very rapidly. One thing that I would ask the Bangkokians to do is that they should follow the situation closely from the reliable source, instead of looking at the social media that share something that is not true. They should check the situation very well. By checking the situation, they should know what is their risk today and how they can adjust those risks. Number 2, they should also follow the recommendation from the government of what they should do, what they should not do. And then the third, the most important things probably, they should learn the most important things. That is, learn what they should do and what they should not do, and bring that into their life and practice that. And so that they can, if they are not getting infected yet, so they can prevent not just themselves but also their family members of getting infection.
So what they should do, wash the hands?
Okay.
Yeah.
First thing first, they should, if they are they are well and they are not infected yet, what they should do, number 1, is they should try to avoid going outside, trying to avoid going into the crowded places. If they cannot avoid that, they should avoid anybody who cough, or sneezing. Stay away 1 meter or 2 meters. Number 3, if they cannot avoid those situations, they should wear cloth mask. That's good enough. If they don't have to worry about the surgical mask. If they can get a hand on the cloth mask, that's good enough. Then they should wash their hand as frequent as they can, and avoid bringing their hand in to touch their face, eyes, nose, or mouth. Number 5, they should eat the food well cooked, and then they should use the serving spoon of themselves. That should be enough, I think, to avoid the infection that they may risk in everyday life. Now, this is for the uninfected, and what is the recommendation for infected person? If they have common cold, like cough, fevers, malaise, or fatigue, whatever.
Just any kind of
flu or cold-like symptoms. If the symptom is mild, and if they don't have any history of exposure to the risk environment, like they've never been to boxing stadium, if they have common cold, stay home and trying to prevent spreading the disease to anybody else.
No need to have medical checkup yet.
No.
Just ordinary flu.
Right.
Stay home first.
Stay home and trying to avoid prevent anybody from getting infection from you. That is probably the most important things. But if the symptoms get worse, they should go to the hospital. And when they plan to go out of the hospital, they should also plan to prevent others from getting infection as well. If they have masks, they should wear masks and go into the hospital with their alcohol gel so that they can wash hands properly. If they plan to stay home, they should think about staying in their rooms, not going outside, not having food with their family members, they should try to isolate themselves as much as they can.
Yes.
These things will help prevent your family members of getting the disease from you.